welcome to our chiropractor clinic. I understand this is the first time you visited us. Okay, excellent. Well, I say excellent. I'm sorry that you're struggling with some muscular pain and spinal pain. But it is lovely to see you and meet you. So, I'll go through what we'll do today, okay? Okay. So we will be taking some personal information. Yeah, we need to go through your medical history, your concurrent medications. We also need to assess, understand where you've been having pain, before I do an examination. I'll then perform the full body examination. I'll have a look at you from the top of your head all the way down to your tippity-tappity toes. Okay. Then we will do some adjustments. That can be crooking your neck, that can be moving your arms a certain way, moving your spine, moving your legs. We'll do some gentle stretches as well, and I will also do a muscle massage if required. So there's quite a few things that we'll do today to get you feeling your best self. Okay, now I have here, can you just confirm your full name and date of birth? Okay, that's exactly who I have here. But I don't have any additional information. So, could you provide me kindly with your address, please? Okay, and what's the post or zip code with that? Wonderful. Okay. Can I also take your phone number, please? Okay, and your email address. Okay. Wonderful. So that's the admin part out of the way. Do you want to tell me a little bit more about any medical history that may be relevant? I mean, you can tell me anything at all. If you've suffered from any form of illness that you have had to see a doctor for. So, okay. And when did that start? Alright, so been some time then. Do you take medications for this one? Okay. Alright, anything else? Okay. And any medications? Any other medical history? And any other medications that were not covered by that? Okay. Understandably, especially if you've got a lot of pain. Yeah. Okay, and have you sought any other help so far for your issues with your spine? Alright. Do you want to talk me through exactly where you're experiencing pain? So, okay, so a sports injury. So you're experiencing pain across your shoulders when you lift your arms, your back, and your pelvis is going down your legs as well. Is it your abductors and adductors anything within your pelvis. So when you're lifting a leg. Okay. So really, we've got a full body here of potential issues. It may just all be stemming from your spine and pelvis, and if we can kind of crack and click those back into place, it might give you a lot of relief. Yeah. Okay. Right. Well. What's key today is that you remain as calm and relaxed as possible, okay? It'll help you and it'll help me. So if at any point you feel overwhelmed, you just let me know and we can do some deep breathing to bring you to a place of calm. We'll actually start with some deep breathings just now, just to relax you, okay? So just breathe in and out. And breathe in and out, and breathe in and out. Alright, there we go. Okay, just try and remain relaxed. As relaxed as you can. Okay, let me have a look at you then. So I'm just going to come across here your shoulders. Alright, if you want to raise your right arm up for me. That's it, okay. Let's see. Okay. And back down. Okay, and the other side. Raise that up for me. Yeah. And down. Okay, and where's the pain? Is it coming from here? Yeah. Okay, and the other side as well. It's just all across to around here. And down your traps. Is that right? Down here. Okay. Right. Your spine, okay. I don't think there's any twist as such in there, but there may be. Let me just, if you can roll slightly onto your side, I'm just going to feel down your spine, okay? Just bear with me. It may all be coming from your neck, actually. Alright. Okay, and then your hips. So, let me see. This is painful in here. Okay, can you gently rotate your hips in a circle? Let me just see that movement. Okay. Alright. Okay, I'm just gonna move your leg, pull your leg up, okay? So, just bear with me. Just gonna gently pull that leg up there. So, is it sore there? In this side. Okay. Alright. And then if the other leg here, I'll do the same. Okay. Bear with me. I'm just gonna pull that leg up. And it's there that's sore. Okay, I'm gonna do that again. Just let me. Okay, and then if we widen your legs like so, so if we do both at the same time, and you pull up like this, how's that? Does that feel? It's even worse. It's widen. That's fine. I'm going to do it again. Ready? Up we come. And back down. Okay. We're just going to lift this one out to the side. Okay. And back around. And out to the side with this one. And back around. Okay. Right. Let me just grab my tools and we will get started on your spine readjustment. Okay. come round here, like so. Now you need to try and be as relaxed as possible. Okay, while I do this, don't panic. There'll be a quick shift. You'll hardly feel it, but it may help, okay? Okay, how does that feel? Try that again. Okay. Right, we'll leave the neck for now and we'll start going down your spine. So I'm going to gently come around here. I'm just going to gently position my hands around your spine, okay? I'll see if we can. I'm just going to push quite hard. You'll be able to hear it. Coming back up here. We're just going to strengthen it. I'm just going to pull this up here. Okay, let's go again. Gonna move on to your pelvis now, okay? I'm just gonna push on that side. And then on this side. How does that feel? I know I'm putting a lot of pressure there. Yeah. Okay, we're gonna try again. We're gonna go back over to this side. It's quite intense, that one. Okay. I'm just gonna try one more time with your neck, okay? I think that's us with regards to the adjustment. So now I think what's important is that we do some stretches. Some lovely stretches, okay? To see if that's worked. Alright. So let me just grab a drink really quickly. Alright. So I need you to turn your head from side to side. Like so. Side to side. Okay. And then I want you to roll your neck from side to side. So roll it. Okay, and then all the way around. Turn round. Okay, how does that feel? Okay. Exactly. Good. Okay. Now I need you to shrug your shoulders. So just gently shrug like so. Good. Shrug again. Okay, good. Now do against my resistance. I'm just going to put my hands on here. Shrug. Good. Okay. And then I want you to just try and relax your body a little bit. I want you to lift your arm. So raise your left arm up like this. And then gently stretch over the side of your head. Like so. Good. And then the other side, lift your right arm and stretch over to your left. Good. Okay. Great. Great. That seems to have helped that. Now, how are you finding your pelvis? Do you want to give me those hip circles again? So just circle your hips one way and then the other way. That's it. One way and then the other way. Good. Okay, and just sort of shimmy yourself side to side. Alright. Now your legs. So I'm going to help guide you here. So we're going to lift this leg up again. And down. And up. And down. Feels better, but those abductors are still sore. Yeah. Understandably. Okay. We're just going to try and circle your leg like so. Okay. I'm going to pull it out slightly and back in and out. In and out. So we're just going to fill up and down, up and down, and up and down. Now we're going to circle. Like so. We're going to pull out the way back, out the way back, out the way back. One more time. Okay, great. Wow. What's important now? We are going to do your massage. Your massage like on the sore muscles, so on your shoulders and on your thighs. So let me just see. So we're gonna use this one. Just give it a good spin. This is a really nice oil, fragranced with lavender and sweet orange. this on. And we're just gonna gently massage your shoulder. Side. How does that feel? Okay, we can come back to that. What we're going to do is we're just going to take your leg just now. And I'm going to gently massage in that abductor. We're going to come along the inside of your leg just because you need to really massage that out because that will give you a lot of pain if we don't fix this. How's that feeling? Do you need more pressure? So let me just put a little bit more oil. We're gonna just massage the other leg, okay? There we are, just really get in there. We're just gonna pat this dry. Okay. shoulders, try to get the excess oil up there. Okay. And then we're going to do the same for your leg. The other one. Alright. How are you feeling? Okay. You're feeling okay. You sure? Alright. Now, give it a few days. Sometimes you'll see an immediate effect of this session. Sometimes it takes a few days. You might feel a little bit sore in the morning. So if you do, just take some ibuprofen and paracetamol if needed. But just try and relax and rest, and then start gentle exercises such as your stretching that we did today, and also just gentle walking, no vigorous exercise. And then when you start to feel better, we can build that up so that you can get back to feeling your best. Alright, do you have any other questions for me today? Are you pretty happy? Okay, well, if there's anything else you need, or you feel you need another few sessions, you just let us know, okay? Alright, thank you so much for seeing me today.